So Ruben serves as the Medicaid Federal Policy Director at the Oregon Health Authority, and he has been serving as a public health visionary for 17 plus years experience, strengthening health and human services systems and expanding access to care. His culturally grounded leadership style is guided by the values of mindfulness, integrity, and courage, resulting in achievements such as the establishment of the Medicaid reimbursement for community health worker program and doula services in Arizona, and champion value-based care quality health metrics. And he shared with me earlier that he actually used to be an outreach worker. So he's one of us, and welcome.
And thanks so much for that kind introduction. It's so great to be among you all. And when I found out that there were so many outreach workers in the audience today, my heart just sang. It's work that is truly important to me and how I got my foot into the door in health and human services in the United States. So, really happy to be among you all today. So I'll be presenting on a topic that got queued up right before I came on, some of the federal policy changes that are going to be impacting the Medicaid program in the upcoming years. You all have probably heard quite a lot about House Resolution 1, so that will be the focus of my talk today. Um, to provide a little background information, HR1 was signed into law in July of this year. Um, and among other things that HR1 is going to do is reduce funding for Medicaid significantly and make a series of policy changes to the Medicaid program, such as stricter rules for eligibility and more frequent eligibility reviews. Work requirements will be required for some Oregon Health Plan members, um, and changes to eligibility for marketplace financial assistance have started or are going to start in 2026. Medicaid changes will not happen immediately and are going to be phased in. As we begin this discussion, it's really important to me that I ground this discussion um, in the recognition of those who are going to be most impacted by HR1. So on this slide, I'm calling out some of the groups that are going to be most impacted by HR1, including rural residents, working families, people with disabilities, immigrants and refugees, families with mixed legal status, and caregivers. I also want to ground us in some of the Oregon Health Authority's agency goals, which include keeping people covered, reducing inequities and harm to the people that we serve, and adhering to federal mandates that preserve Medicaid funding. One of the most talked about changes that's occurring under HR1 is a work requirement. As of December 31st of next year, states will be required to establish work or other activity requirements for a specific group of Medicaid beneficiaries. This specific group of Medicaid beneficiaries are aged 19 to 64, and they're in the adult expansion group, over 100, with incomes over 100% of the federal poverty level. Individuals within this group will be required to comply with at least 80 hours of work or related activities for the month prior to application or the renewal month. This next slide provides a little more information on the work requirement. Um, so HR1 expressly prohibits access to subsidized marketplace coverage for those who lose Medicaid as a result of the work requirement. OHA and ODHS, our sister state agency, are actively collaborating on program design around Medicaid and SNAP, given that there's one eligibility system used to determine eligibility for the two programs and the work requirement that is in place for each of the programs. We'll need to make major IT and system changes, and these IT system changes are going to directly impact Oregon's ability to keep people enrolled. We're very engaged in work to make sure that the system is designed in a way that supports people complying with the work requirement and documenting their compliance with the work requirement. States must use reliable information available to verify compliance. So uh, this can include income and asset information, as well as information that we're not currently accessing, but planning to access, such as educational enrollment and participation in volunteer work. There are optional short-term exceptions to the work requirement, which can include certain individuals in skilled nursing or inpatient facilities or residing in counties where the unemployment rate exceeds a specific threshold. Also important to note that American Indians and Alaska Natives are exempt from the work requirement, and individuals with a complex or serious medical condition who are referred to as medically frail are also exempt from the work requirement. With that, I'll take us into some of the changes to Medicaid eligibility that are going to happen as a result of HR1. Eligibility changes include ending federal Medicaid and CHIP funds for certain non-citizens. Right now, there are several non-citizen groups that are eligible for Medicaid coverage. As a result of HR1, only four non-citizen groups are eligible for Medicaid and CHIP coverage. HR1 also establishes a requirement for states to verify death eligibility, which means consulting a list of deceased individuals to make sure that deceased individuals are not continuing to be enrolled in Medicaid. HR1 establishes limits on home equity for purposes of determining eligibility for Medicaid long-term services. It also reduces retroactive coverage for Medicaid, which is currently 90 days. So retroactive eligibility for Medicaid can be claimed up to 90 days prior to the initiation of the Medicaid application. That's getting scaled back under HR1 to 30 days for the expansion population with incomes over 100% FPL, and 60 days retroactive eligibility for individuals who are qualified for Medicaid and do not belong to the expansion group. Um, the HR1 also requires for redeterminations to be conducted every 6 months and is going to implement co-payments for individuals with incomes over 100% of the federal poverty level. Some of the highlights from the eligibility changes I've just mentioned include we will be redetermining eligibility every 6 months. This is slated to take effect toward the end of 2027 or early 2028 when Oregon's 1115 waiver authorizing continuous eligibility is slated to end. Cost sharing will become required in October of 2028, and we're actively designing a policy that is going to minimize the impact of cost sharing and really um, uh, be mindful of who is subject to cost sharing and which services are subject to cost sharing. Um, the other eligibility changes that I've mentioned will be required and will reduce federal reimbursement. And we think that this is going to inevitably result in reduced Medicaid enrollment, which may lead to increased uninsurance across the state. I'd also like to talk at a very high level about some of the marketplace changes that are slated to take effect. So, beginning this year, there was the removal of the advanced premium tax credit, or beginning in 2026, the removal of the advanced premium tax credit repayment caps. Um, Beginning in 2026, we're also going to see certain non-citizens beginning to lose access to premium tax credits. Um, and that's going to continue into 2027 when refugees and asylees will no longer be eligible to receive premium tax credits. Um, Major system changes that are going to impact the marketplace include a shortened open enrollment period, which starts with the 2027 open enrollment period. And those system changes will continue into 2028 um, when automatic re-enrollment is going to end. We also want to shout out that Oregon is in the process of planning for the implementation of a state-based marketplace, which is still slated to happen by November 1st of 2026. And we don't anticipate any system changes related to the establishment of the state-based marketplace. Want to also mention some of the work that we're doing around communications and engagement to the regarding the federal policy changes I've talked about today. It's very important to us that we ensure OHP members, partners, the public, and media have timely, relevant information throughout the rollout of HR1 requirements. Um, we've identified key dates, details, and deadlines that need to be communicated and the timeframes that they need to be communicated in. It's important to us that we're developing communications in accessible formats that use plain language and language appropriate messaging to all OHP members and partners. We encourage folks to follow us through OHA's federal response webpage, which is linked on this slide. And Lauren, I'll be sure to share my slide deck with you so you can, so folks can access this link and the content that I'm presenting today. Also want to once again flag that Federal Changes website, flag a newsletter that contains Oregon health news, and highlight our social media presence. We're pretty active on Instagram, Facebook, and LinkedIn, and you can follow us at these links. So that covers my presentation for today. I'm happy to hand it back to you, Lauren. Oh, oh, thanks so much. Yeah, it was great to present. I'm not hearing anything from the room. I'm not sure if y'all's audio is connected. I'm happy to take any questions. I will note regarding questions, there's so much planning that's currently underway that I can't guarantee that I'll be able to provide a response to all of your questions today. I see a note that audio in the room has been lost.
There, Ruben, can you hear us?
Yes, we can hear you now.